Hi, I'm Jamie Kay. I'm an orthopedic surgeon at Central Indiana Orthopedics in Fishers and Anderson. There are several benefits to the Mako robotic joint replacement. The main one being that we feel that we can get the replacement parts in a more perfect anatomic position for each patient. Patients with this procedure tend to have less pain, use less pain medication, they require less physical therapy, they go home earlier, and in general recover quicker. Every time we do a Mako robotic joint replacement or a traditional joint replacement, we try to be as minimally invasive as we can. The most critical part of a joint replacement is getting the parts in the proper position so that they will last. And that's far more important than the size of the incision. We always try to protect the soft tissues, and what the robotic procedure allows us to do is to protect those tissues better, but that does not necessarily mean it's going to be a tiny incision. So I think patients need to be careful that they know what they're asking when they ask about minimally invasive or not. Average length of recovery time after surgery for a joint replacement varies quite a bit. It's much quicker for hip replacements than for knee replacements, just because hip replacements tend to be less painful overall. I think most surgeons would say that to reach complete recovery takes between 1 and 2 years after surgery. So that would be long-term recovery. In regards to how quick is the early recovery, how fast do you go home? With these procedures, we are sending many patients home the same day or the next day. Some patients will stay 2 days, but that's about as long as most patients will stay these days. At the current time, we can do hip replacements and knee replacements and partial knee replacements using the Mako Robotic Technology. There is future work considering other joints, but that's what we're doing right now. Certainly, we recommend conservative treatment prior to considering joint replacement. This typically would include oral Tylenol or other anti-inflammatories. Also would include oftentimes joint steroid injections and possibly physical therapy. In our patients that are a bit overweight, we recommend weight loss, as that can help with pain as well. A Mako robotic total joint procedure is charged the same way as a regular total joint procedure, so there should not be any difference to the insurer or the patient. We would consider a happy patient to be a successful result in the simplest terms. Our goal with any joint replacement is to get the patient back to their pre-arthritic condition in regards to their quality of life and what they are able to do. All the activities that have been lost due to the painful joint, we hope to get back for them. If you're having hip or knee pain and would like to be further evaluated, please come see us at Central Indiana Orthopedics.